10 years ago, I made a video about getting my wisdom teeth removed, and it's the most viewed video on my channel. I made the video because I was really concerned with what I should expect when I was getting my wisdom teeth pulled, and I didn't think there was enough content out there. This was 10 years ago, so content has changed drastically. But I came up in the same situation again recently when I had to get braces again, and I'm over 30, and I was Googling, looking up on YouTube about adults who have to get braces, what's the downtime, recovery, pain, complications, Invisalign versus traditional braces like I have, and I didn't find a lot of videos that could help, so here I am again. A quick background on why I had to get braces. I have a congenitally missing tooth. So what that means is I was born without a permanent tooth in that place. So I had a baby tooth, and I know some people to this day who still have the baby tooth in that area, but I had to get braces when I was younger, and so they pulled the baby teeth that were still in my mouth when I was getting the braces on, and that included that tooth. Scans, x-rays, all that good stuff, you know, came back, blah, blah, blah. They knew just congenitally I never had an adult tooth that would come into that location. So when I was younger and I had the braces removed, typically your next steps all that time ago were to wear your retainer for a certain amount of time, and then you were done and you had perfect teeth. What they've discovered over time is that that's not the case whatsoever. It's our lips and tongue that move our teeth, and so we have to have ongoing care to continue to keep our teeth in the corrected manner. So now that usually means you get like permanent retainer, like a wire across the back of your teeth, and you know, like clear, snap in, like what look like Invisalign, but as a retainer that you wear to bed forever. I'm getting ahead of myself. Back then when I got the braces off, I had a space there, and they said, okay, you need an implant. And that was a long time ago, right? So I was young and I was just like, nah, man, I'm good. Lo and behold, as I got older, my bottom teeth began to shift ever so slightly into the direction of the missing area. Also, the tooth adjacent to that space began to descend. And all those problems added up to my bite going off center, which resulted in my developing TMJ. So I decided, after years and years and years of dentists telling me that the next step for me was an implant, I got to the point where the dentists were like, we can't fit an implant in that space anymore. It's collapsed too much. So now you need braces again to open up the space, and then an implant. So I was really left with a decision. Do I go through all this dental treatment again, or do I just skip it and hope for the best? Is it really affecting my daily life? Well, it was. The jaw problems that I had ended up resulting in pain, clicking. Also, the tooth that was extending from the top into that space was giving me issues. Since I didn't have all the teeth on the bottom on the right-hand side, I would chew tougher foods on the left. I would chew most of my foods on the left, so I would get a lot of cavities on that side. So after having a couple conversations with multiple doctors, multiple dentists, some oral surgeons, and orthodontists, I found a great team of people that I decided to pursue my orthodontic treatment. So some of the questions I get asked all the time are, why didn't you get Invisalign? And the answer is, I didn't qualify for Invisalign. I had to fix a crossbite, an overjet, my TMJ, add spacing for an implant, all that stuff. So I didn't qualify for it, so it really wasn't an option for me. I did go for a second opinion. They said the same thing, so I went to an orthodontist in a different state that I had gone to when I was younger. So I came back and she's funny. She said, I did a good job on you, but yeah, you never got that implant. So one of the things in my treatment plan was to correct my crossbite. So when you draw a line between your two front teeth to the bottom two front teeth, it's supposed to line up, and mine didn't at all. So here's a photo of how my teeth were. So you can see if I were to draw a line, it would be crooked. So that was one of the things that they aimed to fix. And then also I had an overjet, which means the way that your front teeth come down out of your mouth is supposed to be at a specific angle to help with chewing and food and the structure of your face. So mine came out too much. It wasn't a lot. It really wasn't that noticeable. Just looking at this photo, you probably can't tell. So that's another thing that they fixed. And they did that with elastics. Elastics helped with a lot of different polishing that they had to do. So for the elastics, they would give you baggies of these small elastics, like little tiny rubber bands. And they give you this little tool that you can put them in your mouth, or you can do it with your fingers. I always find it easier with my fingers, but this is probably a little bit more hygienic. The elastics come in different sizes, and the sizes correlate to like animals. So I was using the sea otters and the elephants. So it depends, like the one I showed you where it was just from one location to another location, that's a tighter rubber band than the one you need in order to hook in the back, over the top, down through the front. It has to have a little bit more give to it. So there are different strengths, different thicknesses to the rubber bands. These are two different ones. I'm so pale. I'm sorry. Here, I'm so pale. Not sponsored. There you go. I'm like, can you put it on my face? So those are two different rubber bands. One is thicker than the other. So it depends what your treatment needs. I'll show you a few different ways that I had to wear my elastics and what those things did. For 6 to 12 weeks, I think, through my 12-month orthodontic procedure, I had to wear elastics like this, from a back molar to a front molar, on one side, and then for like another 6 weeks I had to wear them on both sides every moment except when I was eating. That was correcting the overjet. So the teeth that were coming out a little bit, I mean, not to that degree, but sticking out a little bit, were kind of reined back in. For another 6 to 12 weeks I had to wear it in this other angular way. So from a back molar over a front molar down to another molar. It was kind of crazy. I had to wear it on both sides, but only 12 hours. So pretty much I would just put them on after I had dinner and leave them on until I woke up in the morning. So maybe like 7 to 7. So that was correcting the way my teeth sat together. So your teeth are supposed to kind of complement each other. Your teeth don't do this. Your teeth kind of fit into the grooves. So it kind of reined in everything together. Additionally, I had a power chain for a really long time, but mine was metal. A lot of people have like a plastic power chain. I have the plastic power chain right now. There's like a shiny rubber band in like figure eights around all of my braces. I had it in metal for like 7-8 months, and then they switched me in the last 3 or 4 months to this plastic one. And that's so like when you're wearing the elastics and it's like pulling from behind, they don't want all your front teeth to separate, so the power chain keeps everything really locked in tight. So for these final 2 weeks I won't have any elastics, which is wonderful. I'm done, and the power chain will help with that tiny bit of space between my two front teeth right now. Additionally, to keep that space open, the braces need a spring in between the two teeth where the space is. So the spring started out with a thinner coil, and each time my braces got tightened, which was every 5 to 7 weeks, they would make the spring either longer or a thicker wire so that it would stay open. So that part wasn't very painful because it was so gradual. The painful part, so let's talk about pain and what to expect. Everybody always says it's more of a pressure, and I agree, that is correct. It is like having pressure on your teeth all the time. But the painful part for me is when you're trying to eat. When you're trying to eat, and you have recently had them tightened. So the day you get them tightened, you're probably going to be experiencing discomfort and trouble eating, or resting your hand on your face. Like if you actually push, like that's going to be painful, in the uncomfortable way. Not sharp pain, but just dull residual kind of throbbing pain. And then the next day for me, usually by the day after that, I'm fine. I might pop a Tylenol. I'm one of those people who don't really like to take pain medications because I feel like if I take them all the time, they won't work when I really need them. So I didn't take Advil and Tylenol or ibuprofen, any of that stuff during this treatment except for the really tough ones. So every 5 weeks for a year, I had my braces tightened, and I probably used Tylenol 6 times total. 12 months times 4 weeks each month divided by 5 weeks. So I had my braces tightened roughly 9 times, 10 times, and 5 or 6 of them I popped. Okay, so like half the time I popped a Tylenol. That's more than I thought. The elastics do also cause discomfort. So if you have to wear them all the time, when you take them out and eat, when you put them back in, whew, the rubbing against my gums got to me a little bit, especially because most of the brackets have little hooks on the tops for all the elastics that I had to do. All those little hooks all on the top and the bottom, and it really only bothers me when I am face to face with people at like a conference, because you're smiling, you're laughing, you know, you're doing this all day and your gums are rubbing up against those things. Every so often it would open up a canker sore, but really maybe 4 in a whole year. They give you wax, so you can get these strips of wax, and the wax should be free at your orthodontist. You can get one of these every time you go if you want. I only have 1 small piece left. Here's half a piece of one, and I'll use it now because I'm not gonna need it anymore. You would just break off a piece with your finger and say, say this is the one that was bothering me. Yeah, I would just kind of like smush it on the bracket. So, and it feels nice as you're just like, your mouth is gliding over it. I would just forget it's there. It stops hurting immediately. So this is a saving grace. It just looks a little funny, but the front ones never really bother me. It's the ones all the way in the back that really like hook into your gums. The other rough part about a congenitally missing tooth is that your jaw for your entire life hasn't been supporting a tooth in that location. So the bone in your jaw recedes a little bit. So there's some regression there. If I were to feel along my jaw, I can feel exactly where that missing tooth is, because your jaw has a bit of like a low, here, kind of like this. There's a bit of a divot where there has been no tooth, so there's no bone there, or less bone. So one of the things the oral surgeon has to do is determine whether or not you need a bone graft. It's not as scary as it sounds anymore. Bone grafts used to have to come from the patient, so they would take bone from another part of your body and use a small piece to put into your jaw, and then it took months for your jaw to like form with that bone, and then you were ready to go. Thankfully, we're ahead of the times. They actually just sprinkle in some donor powder, sew you up, and then you wait a few months. Or there is a way for them to do the implant at the time of the bone graft, but it really depends on how intense that bone graft is. There are a couple factors that I am not a medical professional, so I don't know everything, but this is how it was explained to me. There's an option to do the bone graft and the implant at the same time, but in my case, it's very likely that the CT scan is going to show that I need more bone grafting. So in that case, I probably will need the bone graft, and then I have to wait about 5 months for that bone to solidify and be able to support an implant and go back in and have the implant. Then I have to wait 2 to 4 months for the abutment, I think it's an abutment, placed around that area, and then another 2 to 4 weeks to have the crown placed on top of that. And that is done by your dentist. So you've got a cost from, in my case, the orthodontist, the oral surgeon, and your dentist. I was also kind of upset when I got my braces on that they weren't invisible. I thought, I did get ceramic brackets, which is why the brackets themselves are white. It's a little hard to see because I've got that like shiny power chain on top of each bracket. But there's a lot more metal that's visible than I expected, and that's because each of the supporting, hooks, like the holders around each bracket, those are metal. So there is metal on each bracket, so there's metal visible when you smile. And I also had a metal power chain, which was like twisted around every tooth, so it was really much more noticeable when I first got them on. In order to make sure that my braces were always clean, because food does get stuck in them a lot, I avoided certain foods when I was out in public. Like if I was eating lunch with my friends, I wouldn't get things like bread, like sandwiches, because biting into like Wonder Bread especially, all that like mushy white bread will just go like right into your braces. So I would recommend carrying around a bunch of these, and you can get them at CVS. They have little caps, so they're nice and sanitary, and you can bend this however you need it. I would carry this stuff in like a little baggie. So I'd have this, I'd have this, I'd have my rubber bands, I'd have my wax, and then I'd have this mirror. And you know, after I was done eating, I'd run to the bathroom. I think at the end I was getting lazy and I was just doing this at the table, which is not the best. I would just go like this, down into each pocket between the brackets under the wire, like that, to clean them out, and then that was it. Also, you can't floss when you have braces. Not with regular floss. They have floss threaders. So you would take your floss and you would attach it to your floss threader. This is just like a small, difficult to see, plastic, there we go. And it works just like a needle, where you thread the floss through that hole. And you can actually physically tie it if you want. You don't really need to. Then you take this plastic part and you go under your bracket. There you go. So I threaded it. So that's how you would then take it. Now I just flossed one spot, so you have to thread it through every single tooth. Ain't nobody got time for that. So what I would recommend is getting a water pick instead. If you have a really great orthodontist, they'll probably give you a coupon, or you can just go get a coupon to Bed Bath & Beyond, because they sell this, and you can get a coupon for like 20% off one item at Bed Bath & Beyond anytime, even on your phone. You fill the reservoir with water, and then you attach this and you aim it like at the top between your teeth, and then you push the on button, and it's like a water pick at the dentist. It just squirts water pretty rapidly. It's not painful, like it's just, I'm wondering if I can demo this, and I'll just do it, I'll clean it up. So this is a pretty rapid stream of water, as you saw. It's a lot of water, so you just hang out over the sink and aim it at your teeth and keep your mouth open, and it just kind of like goes through all the water, cleans your mouth, and like goes into the sink. And this thing runs like, I think like 60 bucks, so use that coupon and it's a really good investment, and it will all get the stuff out of your teeth. It's great. The other item they told me to get was this extra fluoride toothpaste called Prevident 5000. It smells like berry, it's pink in color. You just brush your teeth. I can't really speak to costs because every single person and every single insurance plan and every single practice is different, which really stinks about America. It was expensive. It was very expensive. As an adult, having to pay for it myself, I have insurance. I even have dental insurance, but it's a dental insurance that includes a maximum lifetime of orthodontic treatment at $1,000. I mean, the scans alone to determine my treatment were over $600, so that $1,000 didn't stretch very far. Because you can't get an idea of what it's going to cost before you jump into it. So I just did a lot of research. I called my insurance company. I asked if the specific companies I'm using are covered, how much is covered, do I have maximums, do I have percentages, like does the orthodontist charge a certain amount and then the insurance covers maybe 40% of it and I cover the overage, what would that be? They weren't exactly helpful, but at the end of all my research, I determined it would either be this cost, which might be a covered amount. So after insurance coverages and applicable premiums and deductibles, I had a number in mind. And then I had another number that was in case that stuff never went through, didn't work, wasn't qualified. So I knew it would be, in the best case scenario, this cost, in the worst case scenario, this cost. So I always planned to pay the worst case scenario cost and just be pleasantly surprised if I saved any money along the way. When it was time to get the braces on, the orthodontist had payment options. And one of them was if you paid with a check up front, you could get a $500 discount. So if you are in a position to do that, that might be something worth asking about if there's any sort of discount for cash. The downside there is you'll probably have to be reimbursed by your various insurance companies. Obviously, you have to have all that money to lay out up front, so it's not an option for everyone. Also, keep in mind, in my specific situation, I also had to have an implant, and I haven't even had that yet. So in addition to the cost of braces, I had this cost of an implant looming over my head, where I did my similar research to determine worst case scenario, best case scenario. So I hope this video helps some folks figure out, what they can expect with braces and whether they want to go forward with them or not. And if you have any questions, please leave them in the comments. I'm more than happy to get back to you. I'll make another video about the implant once I get to that stage, which should be pretty soon. All right, thanks for watching.